Welcome back to Miss Jana's Learning Cafe. Today I want to talk to you about the 13 categories that are used to classify someone for an IEP. I'll tell you the title and I'll give you a short description of what they each look like. Just a refresher, the 13 categories are autism, blind or visually impaired, communication disorder, deaf and blind, developmental delay, deaf or hearing impaired, emotional or behavioral disability, intellectually disabled, multiple disabilities, orthopedic impairments, other health impairments, specific learning disability, and traumatic brain injury. Our first classification group is autism. This is a disability that is categorized as a developmental disability affecting the verbal and nonverbal communication and social interaction of a person. A screener for the autism spectrum disorder characteristics can be given by a school psychologist if a medical diagnosis has not yet been given. In this category, verbal and nonverbal communication, as well as social interactions, must be considered and needed to be addressed in order for the student to make progress in the general curriculum. A student may have a medical diagnosis of autism, but not need an IEP service because their educational progress is not being impeded. Often these classifications have goals for social interaction and speech and language related services. Category 2 is for blind or visually impaired. This category has a legal as well as an educational definition. Legal blindness is based on visual acuity, the ability to clearly distinguish and discriminate details using your sight. Legally blind is 20/200 or less after sight correction, like glasses. The educational definition emphasizes the correlation between the visual impairment and education. Category 3 is a communication disorder. This is also known as a speech and language impairment. These students struggle with communication and are often serviced by a speech and language pathologist. Speech impairments are articulation or errors in the production of speech sounds, fluency or difficulties in the flow or rhythm of speech, and voice disorders or problems in the quality or use of one's voice. Language impairments are any impairment in comprehension or the use of spoken and/or written symbols of communication. Language looks at the phonology, the speech patterns, morphology, the inflection, syntax, grammar rules and patterns, semantics, which is the context, and pragmatics, or the function of language. Category 4 is deaf and blind. For this category, think Helen Keller. This disability provides a severe communication and learning developmental needs due to concurrent disabilities. Category 5 is developmental delay. This category is only for children ages 3 to 7 who manifest a significant delay or defect in one or more areas of development like communication, motor skills, cognition, social, emotional, or adaptive skills. Before the student turns 7, a new classification must be met through the evaluations and team determinations. Classification number 6 is deaf or hearing impaired. This category indicates a hearing loss that adversely affects educational performance and ranges from mild to profound. Not all students who are deaf or hard of hearing will receive services. Category number 7 is emotional or behavioral disorder. Students who display long-term inabilities to learn, build and maintain interpersonal relationships, express appropriate types of behaviors or feelings under normal circumstances, or have a medical diagnosis of depression or anxiety that adversely affects their ability to perform educationally enter into this category. Often, special education teams will look at medical diagnoses given by doctors. Oppositional defiance disorder, selective mutism, and extreme anxiety or depression are examples of medical diagnoses that may qualify a student in this area. Services that they receive include social and emotional learning and social skills. Category number 8 is intellectually disabled. This definition is significantly sub-average general intellectual functioning and adaptive behavior that are manifested during the developmental period and adversely affects the educational performance. When looking at cognitive scores, these students have a GIA or full-scale IQ scores 2 standard deviations below the average range. I want to show you this average range right here. Falls in 85 to 115. So 2 standard deviations is anything that's below 79. Mild disabilities fall in the 50 to 70 range. Moderate fall in the 30 to 50. Severe falls in the 20 to 35. profound scores fall below 20. Adaptive skills are how well a student is able to care for their daily living needs. Adaptive skills include things like washing, dressing, taking directions, walking, and moving the physical body. When looking at this classification, it is not unusual to have an occupational therapist do assessments to look at muscle strength and ability. The next category is multiple disabilities. Multiple disabilities that provide a combination of impairments that cannot be accommodated in a special education program solely for one impairment. These often include intellectually disabled and severe orthopedic impairments, but it can include other combinations except deaf and blind. Category number 10 is orthopedic impairment. A severe orthopedic impairment that adversely affects a student's educational performance includes impairments caused by congenital anomalies like clubfoot or an absence of some member, impairment caused by disease like bone tuberculosis, and impairments from other causes like cerebral palsy, amputations, or fractures and burns that can cause contusers. Category 11 is other health impairment. Students who have physical and health conditions caused by congenital diseases or generative anomalies may have this classification. Often, students in this category have limited strength, vitality, or alertness due to their health problems. These students may need assistive technology, such as a wheelchair, a walker, feeding tube, pump, inhaler, etc., in order to function in their daily life. Examples of disabilities in this area include, but are not limited to, ADHD, cancer and leukemia, brain tumors, cerebral palsy, cystic fibrosis, diabetes, and epilepsy. Category number 12 is specific learning disabilities. These are a severe discrepancy between the intellectual ability and the academic achievement, where there is no other condition that causes the problems. Back on this score, if we were to look, up here we would have average range of cognitive, and down here we would have lower ability in the academic achievement areas. Listening, speaking, reading, writing, reasoning, and mathematical abilities are considered when looking at this category. Medical diagnosis in this category are dyslexia, dysgraphia, and dyscalculia. Our last category, number 13, is traumatic brain injury. A traumatic brain injury is an injury to the brain caused by an external force that results in a functional disability or psychosocial impairment that adversely affects the student's educational performance. It doesn't include injuries that are congenital, generative, or induced by birth trauma. All of these disabilities are looked at on a sliding scale from mild to severe. Special education teachers are certified in two areas, mild, moderate, or severe. Severe teachers usually teach their students in a self-contained unit in the school and individualize every part of the student's school day. Mild, moderate students are able to participate in general education classes with their same age peers in pull-out or push-in services. Pull-out groups remove the students from the general education classroom for a specified amount of time, as determined by the IEP. Push-in classes is when the special education teacher or paraprofessional is in the general education classroom helping to provide support and instruction. I hope this has helped you understand the 13 classification areas better. I've added a link in the comments where you can find handouts with all of this information. Thank you for joining me today.